right, so we're going to talk about how to use a tourniquet that's approved by the Committee for Tactical Combat Casualty Care tonight. For this, we have several different tourniquets. They are all three approved. The one we are actually going to be using is the CAT tourniquet. The reason we're using this one is because I actually have a trainer for it. We don't want to use the CAT tourniquets that are black or orange because those are the actual real thing, whereas a blue one would be a training tourniquet. So let's talk about this. The reasons why we would use a tourniquet, okay, is for any kind of massive bleeding, arterial bleeding, anything like that that we would be dealing with as EMTs. The CAT tourniquet is very easy to apply, okay? Takes a little bit of setup, you know, so when you're checking your truck off in the morning, you want to look over your CAT tourniquet. The biggest thing with this, okay, get some of the string off of it. The biggest thing is placement, all right? So when we're putting on an arm, which is probably the most common bleeding that we wind up running into as EMTs, we're going to set it up just like this. It also works for if we're having to apply it to ourselves, which we always keep ourselves safety in mind, correct? Okay, so either hole, it's got two holes here for put your loops in. You can put it in either hole, it doesn't matter, okay? And when we put it in that hole, we're going to kind of have a big hole enough for to get your arm in. All right, Velcro it down, and then you just fold it. That's how we started out. The reason for that is because when we want to put a tourniquet on, we want to put it up as high as we can go, either on the arm or on the leg, okay? That way, if we have multiple gunshot wounds, stabbings, whatever, we're taking care of everything all the way from the source where it comes out of the arm. Does that make sense? Okay. Same thing with the leg. If we can get high enough, all right, we can take care of that. It also allows room to put a second tourniquet on if the first one's not enough. Okay. So when we put this thing on, we're putting it on ourselves. Okay. What we want is the tab portion facing us. And there's a reason for that, and I'll show you here in just a second. So we're going to put it on, bring it all the way up. We're going to grab our tab. We're going to pull it as tight as we can. The reason for that is that it helps when we go to tighten our windlass strap, which is this mechanism here. When we tighten this up, there's less to tighten. Okay? So now what we're going to do is we're going to start tightening up our windlass. Okay? So we're going to turn this, and it's going to hurt. Okay? And it doesn't matter if you go clockwise or counterclockwise. Just go the same way the whole time. Okay? And you're going to tighten this up, and it's going to hurt. It's going to hurt that person. And we're going to tighten it until the bleeding stops. Okay? Not till they're going, you got to stop. It hurts. I don't care if I die, but you got to stop. Okay? We have to tighten it up until the bleeding stops. Okay? Now there's going to get to a point where you're going to be like, man, I've tightened it as far as it'll go. And it'll give you resistance just due to the meat, you know, the tissue that's up underneath there. Okay? That's when you may need to think, it's time for a second tourniquet. Okay? So, as you can see, all the veins are starting to pop up. This is not a trainer because it doesn't have the strap in it. It's on here. It hurts. Okay? Now, what we're going to do with that, after the fact, once we get our windlass in either one of the little hook straps, we're going to tie it down with that little piece of Velcro. And then we're going to take a pen. I like using a Sharpie marker, okay, because it's nice and visible. You can actually write it, and it has a little place for time on the tourniquet. I like writing it on their forehead. The reason for that is what I teach y'all about bleeding control. We take care of hypothermia, right? So this person's going to have a whole bunch of blankets on it. Are they really going to see the time notification on the tourniquet? No, they're not. You scrub it across their forehead. When the doctor goes and talks to the patient, what's the first thing they're going to do? They're going to go to their face, right? They're going to see the time. You're going to put a big T in the time. You want to do it in military time. You need to learn that. It's going to be part of what you're having to do as far as your times and numbers for your job anyway as an EMT. So military time is important in this field anyway. All right. So that is how we would apply our tourniquet, the cat tourniquet, to the arm. All right. Now, a little different, applying it to the leg, which is just as important. And actually, if I'm going to get you as a little bit of help. All right. So what we're going to do is, we're actually going to undo the tourniquet. All right. We're going to bring it around. We're going to get it as high up as we possibly can, for the same reason as before. Okay? We just want to be able to move things out of the way. Okay? We don't want to crush anything. All right? But we want to get it high up as we possibly can because we want to put pressure on that femoral artery and want to keep him from bleeding out. All right? So we're going to kind of tighten it up. We're going to put that other strap in there. And this is where we would use both holes versus one on the femoral one, okay? Now you're not going to be able to get it as tight because of the Velcro on this version. And then we're going to tighten it up. And like I said before, it's going to hurt, okay? So looking at his face, okay? Does that feel tight?
It's getting tighter.
It's getting tighter, okay? And the more tight you can get this thing, the better off you are. Okay? And it's going to hurt. There's a thing called tourniquet pain. All right? They'll just have to deal with it. Okay? Same thing here. Once we got our bleeding stopped, or we realize we need to add a second tourniquet, okay? We lock it in place, write our time. Okay? Another thing we want to do is we want to check our pulses either in our arm or in our leg. Okay? Did we have them before? Do we have them afterwards? Okay? Because if the bleeding stops, okay, we should have no pulse left in there. It's all right. Okay? We can leave it successfully due to the band size up to about 2 hours before they need to start thinking about loosening it up or changing it out. Okay? Here in the United States, that's plenty of time to get somebody to a trauma center if they're dealing with this. Okay? You may run into some problems out in the wilderness, but for, then you would kind of loosen it up, okay? Let it kind of flow a little bit. And the big thing out there is you may unlock it, release it, and you may notice that the bleeding has stopped, and you don't have to re-tighten it back up, okay? But that's for those very wilderness type situations. You don't have access to your cell phone. I know, no Facebook, right? It's kind of scary. But you don't have access to your phone. There's no doctor, no helicopter coming to get you, okay? So that is our tourniquet presentation. Thank you very much.